Ophthalmology. Welcome, Dr.
Thank you, Dr. Mohita Sharma, for the kind introduction. It really is a pleasure to be here today, and I want to thank the organizing committee for giving women ophthalmologists worldwide the opportunity to speak about these issues. As was mentioned by our chairwoman, this is something that is often left out of meetings and often not discussed, and it really is a pleasure to be here. So thank you for that, and I'm looking forward to our discussion. I'm going to start us off by kind of telling us where we are. So we're going to talk about the representation of women and the role of women within ophthalmology. I'm involved in women in ophthalmology in the United States, and I'm at the University of Iowa. I have no relevant financial disclosures. And I thought that this quote by Albert Einstein really struck home to what I'm going to try to do today with us. It says, if I have an hour to solve a problem, I'd spend 55 minutes thinking about the problem and then 5 minutes thinking about solutions. So I see my job with this talk is to tell you where we are. Do we have a problem? Maybe we don't have a problem. Let's talk about, get the data out there. And so what I'm really going to do is summarize what we found in this review article. I would like to acknowledge Helen Dinesh Meyer from New Zealand and Heather Gill, who's a resident in New Zealand. They were first and senior authors on this paper that's coming out. It's An Eye on Gender Equality, a review of evolving representation of women in ophthalmology. And there's an exhaustive reference list as well as a supplement that has more references. So if you have any questions or want to look up any papers about this topic, they should most likely will be referenced in this article. And it is coming out, if you actually, you can see at the end my Twitter account, but if you go to my Twitter account, this article is free access till the 23rd of February. So we have a few days left where you can access that free before needing membership in AJO. When we looked, and I was fortunate to be co-author on this article, when we looked at what papers have been out there about representation of women within ophthalmology, these are the categories we found that the papers kind of centered around. And it just happens that a lot of these categories we're going to be talking about today during the panel. So you'll see that I've tried to put one slide together, kind of summarizing where we are with each of these areas in terms of what we know in the literature. And there's a lot missing, I'd like to say. There's a lot of data out of certain parts of the world, and other parts of the world, we really don't have much information at all. So when we look at women in general within medicine and then within ophthalmology, it's really interesting how varied it is around different parts of the world. So we know that the number of women is increasing both within medicine and within ophthalmology. And Europe actually leads with over 50% of women within medicine. And within ophthalmology, it's increased significantly to just over a quarter now within the United States. We are one of the most represented subspecialties in terms of women in the field, and it's about the third highest subspecialty within surgical subspecialties. So there we are in terms of, representation. It varies from about a quarter to half or just over half from the countries that we have the data. What we're looking at is then leadership. Are we leaders yet? We know the numbers increasing. It's going to take some lag. That's understandable. Are we making the progress we should be making? And we found that within the US, within all specialties in medicine, women make up about 18% of department chairs and 29% of division chairs, so almost a third of division chairs. And then when you look within ophthalmology, about 2 out of 15 ophthalmology societies have women as their presidents, and 1 editor-in-chief within a ranked, the big main ranked journal. So there's still a long ways to go there. When you look at the most influential women that came out of the Ophthalmologist, that's a London-based publication. There were 6 women in 2015, and it was up to 17 in 2020. So there's a real concerted effort, one, to recognize those women that are doing amazing work, as some of these pictured in some of many of our panelists, but also more women are out there and leading, and so they're having more opportunities to be seen. And then when you look at awards, actually the number of awards going to young trainees is almost half, and early career awards is increasing to about 36%. So we are making progress in terms of leadership, but we still have a ways to go. And then we're going to be talking more about research publications. Dr. Rebecca coming out of England is going to be talking about that soon. But you can see the number of department chairs within ophthalmology has increased in the United States from 4% in 2007 up to, it's more than quadrupled. And then within all specialties, though, however, we really haven't seen a change in the number of women represented within academic rank. So are they assistant professors, associate professors, or full professors? Despite the increasing numbers of women in these medical specialties, because it's across all specialties, we aren't seeing them rise to the ranks of associate professor and professor like we would have expected. Also, in terms of federal grant funding, women tend to have smaller grants. But however, there was one recent paper out of cornea that showed that within the field of cornea, the federal grants were even within for men and women. Additionally, there's data that shows that women have less partnership with industry and less industry funding. So that's another area that we can work on and continue to improve. And then when you look at the gender pay gap, there's data from India, there's data from the US, the UK, Australia, New England, and the gender pay gap has been shown to still be in place, and even after taking into account part-time work, practice profile, and subspecialty. So you can see here the data that women earn about 12.5% less in the first year of practice. They also earn less per dollar when you're looking in the US. Researchers earn a smaller amount of salaries as well, about 84%. And we have found, though, that women have longer consultation times with patients. They tend to see less patients. And so some of this is involved in some of the gender pay gap as well. So looking into all those things is important. And again, there's still a lot of areas of the world where we don't have that data. And then when we talk about surgical exposure and subspecialization, we found that in the US, the UK, and this is represented in New Zealand and Australia, so that's RANSCO, that women residents tend to perform less surgeries and less cataract surgeries, which of course are one of the main surgeries that are counted in residencies, and that they tend to have less autonomy and feel as if they get less opportunities to do as much of the cases as their male counterparts. Also, women tend to subspecialize in more medical ophthalmology subspecialties, such as uveitis, pediatrics, medical retina, and the representation of women is less in those surgical subspecialties, such as refractive surgery, retina, cornea, oculoplastics. So that's kind of where we stand with surgical exposure. Now, if you look at harassment, there's been more data out there recently on harassment. In fact, we've published some of our research here from the University of Iowa. And workplace sexual harassment has been shown to decrease job satisfaction, confidence, career advancements. We found that in 2020 that about 2/3 of women and 43% of men had experienced bullying or harassment during their training. The vast majority of this is from patients, actually. And 87% of US women trainees, compared to 44% of men, also experienced it sometime in their training as well. So we find that about half of women feel sexually harassed weekly in some way, shape, or form. Now, there's a lot of different types of sexual harassment, but when looking at it in total, over half of the women and about almost 1/3 of the men felt that there was some comment or something that made them feel uncomfortable, and it typically was with patients. RANSCO actually recently just published their data in 2021, and they found a 6 times higher rate of sexual harassment among women ophthalmologists than their male counterparts. So we've got a long way to go here, not just working within our field, but working within our patient population as well. And then when you look at career satisfaction, there's multiple studies show that men and women have similar career satisfaction within the field of ophthalmology. There was, however, a study out of Canada that showed higher burnout rates and psychological distress in women. And some of it has been thought to be to women ophthalmologists feeling like they need to try to do it all, both in terms of work and family commitment. So that's an area I think we'll probably be discussing that as well today. When you look at mentorship, and we're going to have a talk on mentorship today, it's important for both male and female senior ophthalmologists to increase their mentorship of women. Mentorship has been shown to reduce stress, to help with subspecialty choice, to facilitate career advancement, and to kind of give you advice also outside of just clinical practice. And so mentorship has many roles and benefits, and there's just some data that shows that women have more difficulty finding mentors than male ophthalmologists. And then when you get a little bit further into the data actually on the family and marital differences, there's been a study that showed that over 2/3 of women, compared to just 8% of men, were involved in taking care of their families and dealing with family issues greater than 20 hours a week. So they were involved in that care over 20 hours a week, which is a whole nother job in itself. And then the spouses of women ophthalmologists, however, tend to also work outside the home. So there's two people working in the home rather than just one, more commonly in the families of women ophthalmologists. They're also less likely to have children. And in RANSCO in Australia and New Zealand, they found that when they do have children, their first child is usually at an older age than their male counterparts. So now that we've talked a little bit about some of the problems and the data behind the problems, because that's really what we need to do is talk about it objectively. There's some studies that show that actually, once you talk about the problem, you identify it and you work their male counterparts. Thank you. So just wanted to close by saying that at Johns Hopkins, they identified the issue. They a plan to make a change, and in 5 years the women associate professors increased 5 times.
Erin, you can continue because we have less number of talks. So if you want to
continue,
you can continue.
I'm almost done.
Not a problem.
Thank you very much. So I have 2 final slides. There has been shown that a point-based system can make a benefit and show more, improve equity instead of nomination. So moving our awards and our positions in committees, those kind of things, to a point-based system based on involvement, publications, those kind of things, rather than nominations, can help. And RANSCO actually set a target of 35% women on the board and committees, which they have achieved. And the highest rate I saw for gender quota was Australian Medical Association, actually set it for 40%. So I think New Zealand and Australia are at the front lines, really pushing us to think about this in a different way and trying to be objective about it and be proactive about it. Lastly, I just wanted to close by just sharing how wonderful it has been for me to be inspired by all the international collaborations. You can see here just some of the opportunities I've had and that many of us have. You can tell we enjoy each other, we enjoy each other's company, and we also enjoy talking about the problems and the issues, but then also collaborating on looking for solutions. So thank you very much.